we're ready to go. I want to welcome everyone. I'm Dr. Marla Gold, Dean of the Drexel University School of Public Health, and I want to welcome you to the second annual Jonathan Mann Health and Human Rights Memorial Lecture, made possible through the generous support of Dr. Walter Cohen and input from the Mann family. This year, what can we say about this year? At a time of monumental change in the United States and in the world, we are honored and frankly quite filled with wonder to host Mr. Ahmed Kathrada and Minister of Health Barbara Hogan, both of whom represent to the people of South Africa the same promise of change and peace that many Americans hold dear now more than ever. Before proceeding with the program, I want to note several of our attendees this evening. I cannot name them all, and by naming one, I'll probably be in trouble by not naming the others. But I particularly want to note, again, he'll make a face at me, Dr. Walter Cohen, who's a great friend to Drexel University. Thank you. And an advisory council member to our school, and he's here with us tonight. His support has forever endowed the Mann Lecture. Thank you, Walter, from our hearts. I welcome two additional members of my advisory council that are here tonight. I convey greetings from Lydia Mann, particularly, and the Mann family. John's daughter usually comes to this, you'll remember last year. It just so happens that she just returned from Zimbabwe, and timing, we couldn't get her here this evening, but we do extend a warm welcome from her. Another welcome, too, to Mary Teseo and members of South Africa Partners, as well as visiting officials that are here from South Africa. Tonight, we also have representatives of the City of Philadelphia government. I particularly want to mention that Councilwoman Janie Blackwell joined us upstairs before coming down. Esteemed members of the Drexel Board of Trustees, visitors to our school from throughout the region. You know, similar to last year, I think it's a testament not to Drexel, but to Jonathan Mann and the Jonathan Mann Memorial Lecture, that when we've done it, just like last year, we see faces of colleagues from public health programs and institutions from throughout the greater Philadelphia region, and I'm thrilled when that happens. So I want to welcome them. So welcome indeed to the entire university community, along with our provost down in front, Dr. Mark Greenberg. I want to ask that you take a moment, Kathy, in your honor, I'm going to call them gadgets. Please turn off all gadgets as we prepare for a stunning evening. We hope to have time for a few questions at the end of tonight's presentation, so questions that you've already come in with or you have, hold on, we'll run around with a mic. And I want you to note, you already passed it, that there's a reception following in the great court outside this auditorium. And now we have a little bit more intro. It's my pleasure to introduce Dr. John Rich, Chair of the Department of Health Management and Policy and Director of the newly established Center for Nonviolence and Social Justice here at Drexel University. John.
It is a great pleasure for me to be here and to welcome all of you to hear from our honored guests. We at Drexel University, as you know, and at the School of Public Health, have dedicated our work to health and human rights. And through the newly established Center for Nonviolence and Social Justice, we're looking for ways to influence policy, programs, training, to really infuse the notion that at the root of much of the violence we see is trauma and violations to human justice and to social justice. And it is in that spirit that we welcome our guests. And I particularly want to acknowledge a wonderful friend who is here with us tonight, and that is Mr. Ahmed Kathrada. Just to give you some background, from an early age, Mr. Kathrada became active in the movement against apartheid and the movement toward a non-racial society in South Africa. For that, he was imprisoned numerous times, but continued to strive against the brutal regime of apartheid. In 1963, along with other leaders, he was sentenced to prison for life for treason because of the work that he was doing. Those others included people that you've heard of, including Nelson Mandela, Walter Sisulu, Govan Mbeki, and others, many men who came to become leaders in the government that was to be established later. Ahmed Kathrada spent 26 years and 3 months in prison, 18 of which were on Robben Island. In 1989, as a result of an ongoing struggle, he was released from prison and began to participate in the activities that led to the formation through the African National Congress of a democratic society. He was, in 1994, elected to Parliament and served as President Mandela's parliamentary counselor, and he was chairperson of the Robben Island Museum Council until 2006. He has written now 4 books that have described his experiences on Robben Island and his struggle against hopelessness and the way that he maintained his faith. And so, while it's difficult to summarize all that he has done and represents, let me do it with the words of others. Richard Stengel, who was the director of the National Constitution Center, in placing Ahmed Kathrada in context for us, said, if there were a Mount Rushmore of South Africa, Ahmed Kathrada's image would be enshrined there, that he represents those who founded a new democracy out of tremendous brutality. The other person who I will cite is Nelson Mandela, who in the foreword to Ahmed Kathrada's memoir says, Ahmed Kathrada has been so much a part of my life over such a long period that it is inconceivable that I could allow him to write his memoirs without me contributing something, even if only through a brief foreword. Our stories have become so interwoven that the telling of one without the voice of the other being heard somewhere would have led to an incomplete narrative. Kathy's contribution to our liberation struggle and to our movement is well known and well documented. His courage and his commitment to his comrades are legendary. His mature wisdom was an important ingredient of our deliberations and discussions. And so, as we in this country move to a new sense of what the future holds, I would also point out that Ahmed Kathrada has accompanied many well-known people to the museum, which is now on Robben Island, where the prison used to stand. And in 2006, he took then Senator Barack Obama to visit the place where these men stood against this brutality. And so we want to acknowledge him this evening. I'd ask you to join me in acknowledging and honoring Mr. Ahmed Kathrada. Would you please stand?
Thank you, John. Well, there are so many things that can be said about our featured speaker this evening, so I'm going to use voice and video to introduce her. Bear with us as we try this out. She has this look of, uh-oh. Barbara Hogan joined the African National Congress in 1977 following the Soweto uprising. She was the first white woman in South Africa to be found guilty of treason in 1982 and ultimately sentenced to 10 years in prison. She was released from prison in 1990 with the unbanning of outlawed organizations, together with other political prisoners, including Ahmed Kathrada and Nelson Mandela. She has served as a member of the South African Parliament since 1999, chairing the Finance Committee. She has endured torture, a failed assassination attempt, all in the name of working toward a free and equitable South Africa. On September 26th, she was named the new Minister of Health for South Africa, a country under new presidential leadership. Her appointment gives the country newfounded hope. Unlike her predecessor, Barbara believes that, among other things, HIV is the cause of AIDS. How absolutely perfect that Barbara Hogan is here to give the Jonathan Mann Lecture. In a recent speech she delivered at the HIV vaccine conference in South Africa, she said, and I quote, "The right to access health services, including reproductive health services, is guaranteed in our Constitution. This right," many fans, "this right to health is indispensable to realizing the rights to life and dignity for all people. From my understanding," she said, "this means that the right to health is a global public good," unquote. On the evening of her appointment, members of the AIDS Treatment Action Campaign, many of whom she had known for quite some time, showed up at her home to celebrate. They also carried a video camera. Did you realize that when all the celebration was going on? While the lighting is dark, we wanted to share, if we can, the excitement with all of you. So we want to see if we can do this, and we'll put the audio up so that you can imagine what it was like in South Africa.
We've got two surprises today, two wonderful surprises. The one was that Manchu's gone, and the even better surprise is that Barbara has taken her place.
There's not much we can say about Comrade Barbara, except today is the happiest day of our lives.
Where's
Because we've got a Minister of Health who not only has the intelligence and the maturity and the empathy, but also the ability to transform our healthcare system into one that will save poor people's lives and that will actually promote their lives and their dignity and their equality.
That's fantastic.
You've got to do it properly, man.
But let me say a few words about Barbara. In 1970, Barbara got arrested for an anti-government demonstration when she was 18. She comes from a white working-class background in Benoni. In 1977, when it was very difficult in South Africa, she joined the ANC underground. In 1981, Barbara was arrested by the security police. She was tortured very badly. She was in detention for 6 months, Barbara. And that was Monday, 27 years ago exactly, when Barbara was arrested. She then spent 8 years in our apartheid jail. She came out of the jail and went straight into organizing in the labor movement. And much more important, she helped rescue South Africa from civil war. But I remember TAC did a costing study, and she was chair of the Parliamentary Portfolio Committee. And Trevor Manuel came to give evidence, or had to come and explain his budget. And she said to him, "Minister Manuel, why did you not put ARVs in the budget?" And he said, "Those activists, they just talk, they've never costed anything, they don't know how much it's going to cost." And Barbara says, "Minister Manuel, I have here a costing study done by TAC that I know you've received a copy of." And then Barbara was called in by Mbeki and said, "You're not going to do that and you're going to lose your job." And Mbeki then removed Barbara as chair of the Portfolio Committee. And Barbara in caucus, in many places, was known as the friend of TAC in the ANC. For those of us who live with HIV, she's given us hope. She gave us hope when it was dark. So today we want to say thank you to her. She's got the hardest job. Things aren't going to be easy. We hope that she won't go in and think she's going to change everything for us, because she won't be able to do it. But that department and ministry needs some leadership. She's there for a short time. We don't know what's going to happen. So we hope that we can help in whatever way we can, Barbara. This is a time for us to work together and to help. And if necessary, we'll come toe-to-toe too. But not today. Today we're here to Barbara's going to say a few words.
People have said some wonderful things about me, and I want to thank my friends here for saying those things about me. But really, I think the praise really lies with those people who, during the hard times, people such as yourselves in the TAC, fought the hard fight. You've won enormous battles with the greatest of courage, with the greatest of fortitude. You won the battle for government to provide ARVs. That is historic in any country, and in this country even more so. And it was the TAC who led that battle, and I want to thank the TAC for that work that you've done and the work that you continue to do now. And I think there's special people here, and I think we all know Zackie. We know a lot of people who are in the leadership, who have led us and taught us what it means to live in a post-apartheid society, what it means to fight for your socio-economic, your health rights in a post-apartheid society. And for that, we must thank you all. The battle is going to be long. I am not a health expert. I was told by the ANC that they're putting me there precisely because I'm not a health expert, because they want someone with financial and managerial experience. They've said to me they want health improved. Health delivery, they want that improved. That is the mandate that I've been given. And so they're pretty determined about it, and I think I will need your support. I can't tell you how touched I am that you've made your way here this evening. It just deeply touches me that you've taken time out in this cold weather and everything to come out here. So thank you very, very much, and thank you for being what you are, for the battles that you fought, the battles you will continue to fight, and the way you will assist each and every South African to reach their dreams. Thanks.
Ladies and gentlemen, I give you Barbara Hogan.
Thank you. Talk about being ambushed from behind. Your embarrassing moments before an audience. But let me first say that it is a great honor to be here tonight. Health is an issue which is very close to my heart. It's been at the centerpiece of one of the great struggles in and I talk about a post-apartheid society. And I'm privileged and honored by my government, who has appointed me to a post that I hope one day will mean a large difference in the lives of South Africans. Dean Gold, I wish to thank you and Drexel University for your kind invitation to me to present the second annual Jonathan Mann Health and Human Rights Memorial Lecture. I accept this invitation with humility. But before I continue, let me traverse familiar ground. I want to take this opportunity to congratulate President-elect Barack Obama and Vice President-elect This is truly a Mandela moment in the United States. To congratulate President-elect Barack Obama and Vice President-elect Joe Biden on their historic, and I really mean it, historic victory. People throughout the world have heard your message of hope, your commitment to diversity and human rights for all. We are particularly moved by your commitment to ensure that every person in the United States of America enjoys the right to health. I will say more of this commitment later. Jonathan Mann tragically died prematurely in a plane crash with his wife, Mary Lou Clemens Mann, a little more than a decade ago. Their death, or to use his own words, quote, the terrible injustice of early death, affected the global community of people living and those working in the field of HIV. I did not have the privilege of his acquaintance, but I have learnt of his work. The kinship I share with man is his emphasis on human rights. I want to address the themes of dignity, evidence, and global solidarity in the work of Jonathan Mann. These themes are central to all his scientific and public health work. His work is always framed in a human rights approach. The first wave of HIV activism centered primarily in the United States in gay and in injection drug-using communities. And this constituted the emerging context of Mann's approach. Sadly, Jonathan Mann passed on before the second wave of HIV and health activism, which was centered in Africa, Asia, Latin America, and the Caribbean, exploded. I also want to supplement what is present and promised in his writings with an understanding of agency, activism, and access to public goods as part of an emerging global citizenship. I will refer to judgments in our constitutional court, which is the formal equivalent of your Supreme Court, not because I'm a lawyer, but because they are definitive statements about the place of human rights. Today, I want to use three important published works of Jonathan Mann from a wealth of writing that deserves serious study by government leaders, activists, and researchers to examine the 21st century health and human rights challenges that we face. First, his statement at an informal briefing on AIDS to the 42nd session of the United Nations General Assembly on the 20th of October, 1987, the famous UNGAS statement. Secondly, his groundbreaking article called Dignity and Health, the UDHR's revolutionary first article, and this was published in Health and Human Rights. And lastly, his speech delivered at the AIDS charity in London, at London Lighthouse, on the 13th of November 1996, on the transformational potential of the HIV/AIDS pandemic. And this was published in Reproductive Health Matters. Before I address this work, I just want to contextualize my remarks. I will limit them in a large part to South Africa because I am familiar with the crisis of illness, the injustice of early death in our country, and the tragic weaknesses of our public health system. More than 5 million people in our country live with HIV. For the last few years, more than 400,000 were newly infected every year, while more than 250,000 AIDS-related deaths also occurred annually. The burden of the epidemic falls disproportionately on poor and working-class communities, particularly those in informal settlements. Women carry the brunt of the epidemic in the personal, social, cultural, economic, and the household context through vulnerability and infection. Infants largely still die because of a weakness in our mother-to-child prevention programs. In South Africa, according to our Department of Health, between 1996 and 2006, there has been a dramatic increase in incidence of tuberculosis from 269 to 720 cases per 100,000 of the population. In South Africa, we have the highest incidences of prevalence of tuberculosis in the world. The percentage of people co-infected with TB and HIV is estimated to be around 53%, although it is as high as 80% in some communities. The risk of developing active TB is increased tenfold, as you know, by HIV. The average incidence or prevalence for TB in South Africa is not the whole picture. Poor and working class communities face a much higher rate of TB infection than the average middle class person in South Africa. People who are HIV positive in poor and working class areas have the highest burden of TB disease. The average, as we know, marks the inequality. I want to illustrate this with a longitudinal study conducted in a small peri-urban informal settlement in Cape Town between 1996 and 2004. The national average then for TB infection in 1996 was 269 per 100,000. However, in this poor township, the average TB infection rate was 580. By 2004, the period that coincides with the exponential growth and maturing of the HIV epidemic in our country, the national average for new TB infection was 720, and in this township, the average was 1,468 per 100,000 population. The average for HIV-negative persons in the township in 2004 was 656. And HIV positive 4,381 per 100,000. The impact on families, individuals, and communities point to a market and public health failure. I will return to this, but let me turn briefly to the inequity between the public and private health sectors as part of the context. The health system in South Africa is composed of a private healthcare sector which provides services to roughly 7 or 8 million of the country's 48 million people. However, it accounts for more than 50% of total healthcare expenditure. This reflects a serious degree of inequity between these two sectors. The public health sector is relied on by the majority of our people, but especially by the poorest and the most vulnerable. The private sector is weakened, and the middle classes suffer because of unsustainable costs driven by the market, while the public sector suffers from underinvestment, constrained human resource capacity, and a burden of disease that may become unmanageable without global and local cooperation. Our task is to work with our private sector to reduce its costs and to share the responsibility of creating a unified and equitable health system that recognizes the valuable contribution of all professionals in the private sector. If I may be presumptuous, I believe that this is also the challenge for the United States. Ensuring universal health care access as a fundamental human right, especially for your 50 million uninsured people, has been identified as a priority by your next administration. But this also means containing costs in your private health sector and its providers. Your success in this endeavor will determine global health outcomes, because it is here that global insurance and pharmaceutical companies determine market prices. As governments, we have to convince the private health industry that its future lies in cost containment and ensuring equitable access to health as a right. I believe that this approach is compatible with profit, but it requires market imagination and vision. It also requires evidence and citizenship within the framework of the Universal Declaration of Human Rights. To return then to Jonathan Mann, when he addressed the United Nations General Assembly in 1987, he based his analysis on the best available scientific evidence, the impact of HIV on society and individuals, and what he termed the flood of fear and ignorance. Evidence is the first theme I want to address, because without it, no right can be realized. He identified the modes of HIV transmission, the limited epidemiology, and the human rights imperative based on a modernized public health approach. In this statement, he established what became the global legal response adopted by governments, the United Nations and the World Health Organization. Mann argued, and I quote, "Most importantly, there is no evidence anywhere in the world for casual transmission or for person-to-person spread in schools or in the workplace." Close quote. Jonathan Mann's prescient understanding as the most senior global public health official that, quote, "how societies treat AIDS virus-infected people will not only test fundamental values, but will likely make the difference between success and failure in dealing with and close the quote, in dealing with the epidemic is underscored in this particular passage as well. This is what he said. "Fear and ignorance about AIDS continues to lead tragedies for individuals, families, and entire societies. Unfortunately, as anxiety and fear cause some to blame others, AIDS has unveiled the dimly disguised prejudices about race, religion, social class, sex, and nationality." Close quote. This approach has informed the work of our democratic government, activists, our courts, and after many years, also our private sector. In September 2000, an airline cabin attendance case reached our constitutional court. Justice Sandile Ngcobo's approach is infused with the understanding that Mann and his colleagues, such as Peter Piot, brought to this epidemic and public health. Justice Ngcobo ruled, saying, "People who are living with HIV constitute a minority. Society has responded to their plight with intense prejudice. They have been subjected to systematic disadvantage and discrimination. They have been stigmatized and marginalized. As the present case demonstrates, they have been denied employment because of their HIV-positive status without regard to their ability to perform the duties of the position from which they have been excluded. Society's response to them has forced many of them not to reveal their HIV status for fear of prejudice. This in turn has deprived them of the help that they would otherwise have received. People who are living with HIV and AIDS are one of the most vulnerable groups in our society. Notwithstanding the availability of compelling medical evidence as to how this disease is transmitted, the prejudices and stereotypes against HIV-positive people still persist. In view of the prevailing prejudice against HIV-positive people, any discrimination against them can, to my mind, be interpreted as a fresh instance of stigmatization, and I consider this to be an assault on their dignity. The impact of discrimination on HIV-positive people is devastating. It is even more so when it occurs in the context of employment. It denies them the right to earn a living. For this reason, they enjoy special protection in our law." Close quote. In this judgment, the court affirmed dignity and equality as intertwined and inseparable. Justice Ngcobo and the court also accepted that all medical evidence, including the fact that HIV is a virus that causes AIDS, its modes of transmission, disease progression, and the fact that antiretroviral therapy suppresses HIV viral load and improves life expectancy. This is the approach that Mann and his colleagues championed. Governments must often base policy on the best available evidence. It cannot wait for conclusive evidence in areas that, for example, affect human life, health, or the environment. Public health also requires three other interrelated imperatives that governments must consider before implementation of a policy based on new evidence: the right to health, the respect for patient autonomy, and removing costs and systematic barriers to equitable access to health care stand above all this. This basis for evidence and rights-based policy decisions marked Mann's work. In this year, we will celebrate the 60th anniversary of the Universal Declaration of Human Rights. In Dignity and Health, the UDHR's revolutionary first article, Mann identifies 4 types of dignity violations. The first violation is that of not being seen. The invisibility that women, gay men, black people, poor people of all races suffer. The second is being seen, but never as an individual, seen only as the embodiment of a group, such as Muslims or Jewish people with the assigned stereotypes. The third is a violation of personal space that includes one of its most egregious forms, the rape of women or the torture of prisoners. Last, the humiliation of an individual in public. Mann's emphasis on research to establish the connection between dignity violations and health demonstrated the value of evidence to rights realization. But he also places equal emphasis on health officials, especially governments, and I believe ministers of health as moral agents who must recognize that, quote, all human beings are born free and equal in dignity and rights. This ethos must infuse our practices as people who prevent, treat, and care for people who are ill or who are vulnerable to illness. If dignity is not recognized as constitutive of health and access to health services, he warns, quote, future health professionals may look back at the current limited and narrow understanding of health and wonder how we could have missed seeing violations of dignity as sources of injury to well-being. The Constitution in our country enshrines, amongst other things, the rights to education, housing, health, and a sustainable environment. In another case before the Constitutional Court in South Africa on access to housing, known as the Grootboom case, Justice Zackie, on behalf of a unanimous court, found that dignity cannot be separated from access to public goods such as housing, health, and education. The court held, quote, the right of access to adequate housing is entrenched because we value human beings and want to ensure that they are afforded their basic human needs. A society must seek to ensure that the basic necessities of life are provided to all if it is to be a society based on human dignity, freedom, and equality. Those whose needs are the most urgent and whose ability to enjoy all rights, therefore, is most in peril, must not be ignored by the measures aimed at achieving realization of that right. The court has affirmed the right to dignity in cases affecting lesbian and gay people, women and girls under customary law, the right to access antiretrovirals to prevent mother-to-child HIV transmission, and the rights to dignity, privacy, and medical confidentiality of poor black women who live with HIV. This jurisprudence is an attempt to reverse the institutionalized human rights violations of white minority rule. In this context, Justice Kate O'Regan stated the interconnectedness of dignity to other rights most clearly. She said, the value of dignity in our constitutional framework cannot therefore be doubted. The Constitution asserts dignity to contradict our past, in which human dignity for black South Africans was routinely and cruelly denied. It asserts it too to inform the future, to invest in our democracy, respect for the intrinsic worth of all human beings. Human dignity therefore informs constitutional adjudication and interpretation at a range of levels. It is a value that informs the interpretation of many, possibly all other rights. The right to dignity and all other rights in our Constitution were won through struggle by working class, poor and middle class people of all colors with international solidarity against white minority rule. It is a similar coalition today that is required to realize man's vision of dignity in healthcare locally and globally. In his address on the transformative potential of the HIV/AIDS epidemic, Mann asserts that a struggle against inequality on the basis of gender, class, race, sexual orientation, and culture is indispensable to realize the right to health. He invites us to consider this fact and to act on it. Quote, "Yet the contribution of this field and the experience-based insight that promoting and protecting human rights and dignity would be essential for promoting and protecting health has now extended beyond AIDS. Indeed, a new movement linking health and human rights concerns has been catalyzed as public health increasingly recognizes how human rights provides a better framework for an analysis and response than any framework inherited from the biomedical or public health tradition. Jonathan Mann could not have dreamed of the global movement of people living with HIV and their allies that would grow from a campaign to access antiretrovirals to one that mobilizes for prevention, diagnosis, treatment, and cure of TB within a human rights framework. A movement that campaigns for sustainable public health investment and one that recognizes that health is a human right and a global public good. South Africa's people have a history of resisting violations of their dignity. In their struggle to access affordable medicines for HIV, the Treatment Action Campaign united with a number of people, and agencies, including Doctors Without Borders, and the Consumer Project on Technology, and countless people worldwide. Their support, together with yours, was indispensable when our government was sued by multinational pharmaceutical companies because it wanted to make medicines affordable within internationally recognized trade agreements and as our Constitution commands. The Treatment Action Campaign joined our government as amicus curiae, and the day that the court admitted them was the day that drug companies withdrew their case. This movement has grown around the movement that has grown around HIV treatment, TB and prevention from Australia and Brazil to Canada and the Dominican Republic, from India and Malawi to Thailand and Zambia. This is our movement now. This movement, with very strong roots in the United States, is the most powerful asset that governments have to realize the right of equal right to health for all people. Why do I say this? Today, there is a vaccine that can prevent HPV and therefore help eliminate cervical cancer, the leading cause of death among women. Activists in South Africa and globally are asking pharmaceutical companies to substantially reduce the prices of the HPV vaccine for all non-OECD countries. Every government can benefit from this because the burden of disease will be reduced. Lives will be saved and health system savings will be realized. Today we have more than 500,000 people on treatment in South Africa and about 3 million across developing countries because the price of antiretrovirals was dramatically reduced through activism and joint action with some governments such as Brazil and Thailand. This has allowed us to save lives. Activism benefits government budgets, but this is not all. Without the global solidarity and global citizenship implicit in all Jonathan Mann's work, this would not have happened. This was a struggle for life and dignity by people living with HIV. The moral agency and autonomy of citizens that are not nationally defined are embraced in the concept of human dignity. This means that people living with HIV, TB, cancer, hypertension, asthma, arthritis, or any other illness, and people at risk of these illnesses can act independently as citizens in the interest of their health. The movement for HIV treatment across has become a model for a public health movement based on local and global citizenship. People take care of their health with the assistance of health systems. HIV treatment adherence in South Africa has demonstrated this, with more than 80% adherence rates of the first 2 years and more than 75% after 4 years on first-line regimens. You know, I remember when we were arguing for this in Parliament, and we were constantly told that poor people would never be able to adhere to the regime, that they were the most vulnerable. And what we've proved is that poor people, more than any other, adhere to that regimen. We will try to maintain this adherence rate pioneered by activists and agencies such as Doctors Without Borders, because it shows that recognizing individuals as the primary agents with responsibility for their help based on knowledge is central to dignity in healthcare access. Citizens hold governments and corporations accountable. This is a lesson of AIDS. They question health workers, they question health budgets and prioritization locally and globally. While we in government might not always agree with activists, this is the help we need. President-elect Barack Obama will need this help to build a unified universal health system in the United States. This is what is required to build health systems on the continent of my home in Africa. This is a lesson that we have learned in South Africa through our struggle against apartheid and today when we confront HIV. We need the help of civil society to ensure that agencies such as the Global Fund for AIDS, TB and Malaria, and other agencies receive the resources they need because health is a global public good and human right. Our Constitutional Court again recognized this in a case that, as former President Nelson Mandela said, we should never have fought as government, the case on the prevention of mother-to-child HIV transmission. The court unanimously held that a reasonable government program requires leadership, openness, and accountability. Its statement on what is required to realize healthcare access and to treat people living with HIV and to prevent new infections is applicable not only to South Africa. In principle, it is applicable everywhere. The court held, quote, "The magnitude of the HIV/AIDS challenge facing the country calls for a concerted, coordinated, and cooperative national effort in which government in each of its three spheres and the panoply of resources and skills of civil society are marshaled, inspired, and led. This can be achieved only if there's proper communication, especially by government. In order for it to be implemented optimally, a public health program must be made known effectively to all concerned, down to the district nurse and patients. Indeed, for a public program such as this to meet the constitutional requirement of reasonableness, its contents must be made known appropriately." The work of governments, citizens, activists, courts, universities, organizations, trade unions, and corporations on health and human rights owe a great deal to Jonathan Mann. His use of evidence, commitment to human rights and dignity, his mobilization of global action and calls for solidarity lives in all our work. In contexts such as ours, where health services are buckling under the strain of poor financing and poor capacity relative to the level of need, this perspective is inspirational. It lays out a vision as to where we need to go and against which we should be held accountable. And I thank you for this privilege. Thank you.
Thank you. I believe we have a little bit of time for questions on the schedule. We're keeping pretty much to schedule. Do we have a mic in the back that can go? So if anyone has questions, actually I'm going to ask you to come back up. Thank you, Minister Hogan. If you can come to the mic in back or in front with questions for Barbara Hogan, that would be great. I see someone getting up, someone saying, "Oh, what the heck, I'll go first." Hang on for 1 second,
Okay.
and we'll get her up here, and then I will get right out of the way.
Hello, Minister Hogan. How are you? Right here. I recently had the opportunity to visit your country, actually a month ago, on my honeymoon, and what an experience. And we had an opportunity to spend some time in the orphanages with some HIV/AIDS children, as well as spend some time in the townships. And I just wanted to ask you, one of the things that we learned when we were in the townships and informal settlements, you talked about fear of HIV and AIDS. what type of programs need to be created to help alleviate that fear, especially in the communities where you see such high levels of HIV and AIDS cases? Are there currently programs in place? I'm sure that there are, but do you have any plans while you're in your role to implement some programs to help alleviate that fear?
Stigmatization, as you correctly say, is one of our major challenges. It's one of the tragedies that we find people virtually choosing to die and not to take treatment because of the fear of disclosure that they will be found to be HIV positive. I think all of you who've been involved with health will know the stigma that was attached to TB not so long ago. And that is certainly probably our greatest challenge, is to have people have the courage to come forward and to be known to be HIV positive and to be able to accept that treatment. We've been running extensive communications programs. We've been talking, what I hope now, particularly with the change in government, that we will be stepping up political leadership. I think leadership, speaking out, being vocal, as we've seen in countries in Uganda, in Africa, where the political leadership right from the start set the tone, spoke openly, didn't make it something that needed to be hidden, goes a long way to creating the space for people to be able to feel free to disclose. But I also believe that when people go onto antiretrovirals as well, when they are seen to be getting better, they are people who've crossed that bridge from fear of stigmatization, and they've gone over to disclosure, to being on antiretrovirals, and they are our best messengers, because they're the people who are saying, do not be fear, step over, come and join us. We have been engaging our faith-based communities. They definitely need to be more engaged as counselors and encouraging people not to be burdened by that stigmatization. But it's going to be a long road ahead. We need to be messaging, because there's not a standard reason why people are afraid of stigmatization. There's a whole set of reasons, and I think in our ministry we will be looking at the differences and the reasons why, and try to hone in more particularly in our communication messages around that.
Thank you so much again for coming to speak with us. My name is Dan Eisenberg. I worked in Brooklyn Chest Tuberculosis Hospital just outside of Cape Town last year. And I was wondering if you could speak to ways in which you may combine sort of the HIV/AIDS program and the tuberculosis program to sort of increase the efficiency and the productivity of some of the already existing public health infrastructure.
You mean in terms of HIV and TB?
Yeah, sure. And you talked about a few statistics earlier on in your speech. But if there are any other instances where that sort of collaboration would be called for, maybe you could speak to that as well.
Well, we accept any collaboration. It's huge. We can only deal with the issue of HIV and AIDS and TB on the local level. That has got to be something which is accessible to people within walking distance, preferably. The poor, as you know, are most affected. It cannot be that they have to take transport to get access to healthcare. So the primary driver is our primary healthcare system. And as you would know, during apartheid days, there wasn't a rollout of primary healthcare for our black people. Healthcare was mainly the privilege of white people. So we have had the twin burden of trying to set up primary healthcare and dealing with the HIV/AIDS pandemic. And the challenge there is on the local level, the absolute local level. And the similarities of having to adhere to a treatment program between HIV, with antiretrovirals and with TB. I'm struck so often by people who do have HIV, AIDS, and TB. They'll show you their clinic card. And they will say to me, you see, Comrade Barbara, I've been to the clinic, because they have to go for their regular checkups. And in those people's minds, there's no difference It's one and the same thing, that treatment. And that's ultimately what you would want, that people go there. So the synergies that we get between those two in the treatment is very important. Our primary healthcare system is nowhere near where it should be, but what we have been doing is, and this is part of what this talk has been about, is civil society has become extremely engaged. Government has an expanded public works program where we call on community, where we have paid community healthcare workers a small stipend, a public works stipend, to assist us in the rollout of antiretrovirals. These are people who do home-based care, who follow up on treatment to assist people to adhere to the regime, who do counseling and testing. It's a whole army of people who are not necessarily health professionals, but almost paraprofessionals that we use in our expanded public works programs. That has also been an enormous advantage. What we say in South Africa, we will never fight this epidemic unless we have the support of civil society. And it's a multi-sectoral approach. It cannot simply be a health approach. It's got to come from education, from social development. Our comprehensive plan on the treatment of AIDS and of AIDS and TB, of HIV and AIDS and TB, have identified a comprehensive multi-sectoral approach. And it's my intention that we accelerate that in the next 5 years.
Hi, Minister Hogan. It's really an honor to have you speak with us today. I have 2 quick questions. The first of which is the epidemic in South Africa kind of seems to particularly affect young, poor women, I think 15 to 19-year-olds in particular, whereas the epidemic for men is more in the 30-plus kind of range, which a lot of people attribute to kind of the sugar daddy phenomenon. So I'm wondering if you have any innovative ideas about how you might address where the epidemic is really hurting most, especially because of the age of those women and their oftentimes inability to advocate for themselves. And then my second question is kind of how you see your tenure as health minister in relationship to Jacob Zuma and some of his ideas about AIDS in South Africa.
Okay. The first question, certainly part of a driver of AIDS is a sugar daddy phenomenon, but I think it would be a mistake to make it a central pillar. There are multiple factors. In fact, the high incidence for women are women between 20 and 29. That's where our greatest problem lies. In fact, the lower age groups, it's actually beginning to level off, which is an encouraging phenomenon. But there is no doubt in any AIDS activist's mind and in any health professional that the status of women and the inability of women to control their lives, their bodies, their sexual lives is at the heart of what drives our pandemic in South Africa. It's critical. Our government has been, when the ANC returned from exile and we were all released from prison, the women in the ANC were phenomenal, and they said, now we are going to drive a program to improve the status of women in society. And I think South Africa has been remarkable in the way that women have been promoted. There are women in every facet of public life. And it's having its spin-off effects. But for women who are still poor, who are still haven't enjoyed the benefits of that, they are the chief casualties of the HIV/AIDS pandemic. And you're right in identifying that. You're also right in trying to identify certain practices that can contribute to the bigger picture. And that is what we need to be doing more and more in South Africa, is isolating the different trends which escalate the incident of infection, and make sure that our messaging, we can't just have general messaging. People have different responses coming from different communities, from different areas, from different cultures, and we can't just make a general message. And I think our messaging has just been a bit general. As regards Jacob Zuma, sorry? Now, Jacob Zuma is the president of the African National Congress. He's not the president of our country at the moment. Our President Thabo Mbeki he resigned from office about 6 or 7 months before he was due to resign. And President Kgalema Motlanthe is our present president. But perhaps what the person is responding to, Mr. Jacob Zuma was involved in a case in court in which he gave a fairly surprising view of HIV/AIDS, which I'm not going to repeat here. I think it was unfortunate. It was a statement that he made that he has lived to regret. And let me just say this. All of us who fought the battle in the years of denialism in South Africa would know how fierce and difficult it was. I was marginalized, and I wasn't at the forefront of that by any means, but there were many people who were marginalized. And it's a measure of Jacob Zuma. I would never have been appointed to my position as a Minister of Health if Jacob Zuma had not agreed. And he knew what my stance was. And the message that I received from the ANC, from the Secretary General, was, Barbara, you've got to do your job. Move on and get these issues dealt with. He phoned me after I was appointed, and he said, we are very excited by your appointment, and we want to encourage you to do what needs to be done. So I have absolutely, and I'm speaking completely honestly here, I have absolutely no doubt that he will give the backing. His office was in contact with me just recently to say that he would want to play a high-profile role with World AIDS Day. Now, this is unknown. This is for South African politicians to willingly come forward in a high-profile role. And he's absolutely determined that this issue be dealt with. And this is, this is part of I think, of the turnaround that has now happened within the thinking within the ANC. And let me say that a liberation movement that was able to get up and challenge its own president, one of the hallowed revolutionary heroes of our struggle, to challenge our president and have a president, in a sense, removed from office, and the question of his stance on HIV/AIDS was one of the primary drivers of that, shows the extent to which there is a democratic, a strongly rooted democracy in our society. We have a very, very lively civil society. We have a very sophisticated civil society politically. And I'm very proud of what people did. I think, out there, the brave fights that you saw Zackie, Achmat, and the Treatment Action Campaign did, they have spawned a whole new generation of activists that will hold me and future generations of health ministers and other kinds of ministers to account. And I'm very grateful to them, and I think we've turned the leaf. It was almost like you've had your Obama moment. We have in our moments now, and just seeing turns around and things that were very difficult for us to manage in earlier years.
Good evening. It's an honor to have you here. I was wondering, Minister Hogan, if you could speak to your personal experience as a freedom fighter, as someone so closely involved with the liberation struggle, and the parallels you see between that struggle and the struggle against eradicating AIDS, and how you think you can leverage some of those really difficult experiences you had as a freedom fighter in terms of the new challenge that you have that you're facing.
If I want to summarize it, I would say it in one word: it's activism. Understanding how you mobilize society to fight a common cause. When I grew up in the high days of apartheid, in its most powerful era, and we never ever believed that we would see the end of apartheid. When I was in prison, I never believed I'd come out to a liberated South Africa. And that was purely because of the skill, the strength, the endurance of the anti-apartheid movement and activism. What I saw in a post-apartheid society, and you know, it is a pity that we had to fight the battle for treatment. And, you know, the treatment action campaign came out as a response to almost our unresponsiveness to the needs of people with HIV and AIDS. But what that spawned was a new generation of activists in a post-apartheid period that were rooted firmly in the Constitution. And that has been a gift to us as a society, because it's always dangerous with a national liberation movement that you almost live in the revolutionary mythology and you don't hold your liberation movements to account. And suddenly we had these activists saying, no, but this is not right. And at times we joined hands with them when we had to fight the pharmaceuticals, and we achieved miracles. We brought the price of antiretrovirals down. And it's that activism now which says we're going to secure the rights demanded of us in the Constitution. And I always say to young people who are activists, who see themselves as African National Congress, and who feel conflicted and say, but isn't this meaning that we are anti-government? And I say, to demand the rights that are there for you in the Constitution is your duty as a citizen. It doesn't mean you're anti-government. It means you're pro-human rights. It means you're pro the Constitution. The Constitution is above governments. And so we've seen an energizing of the civil society space that one would not have thought. We would have thought we would have gone into a lull and whatever, and suddenly we've seen these marvelous young people, and the parallels are very similar to what you see in the United States. Young people who are coming, who haven't lived through the apartheid era, who are saying, excuse me, but we have our rights as well, and who are mobilizing and doing wonderful things. And I think whatever the rocky paths we are in South Africa at the moment, what restores my faith is that very issue of activism and the traditions that we've now been able to take from an anti-apartheid struggle and bring into a post-apartheid era, and that's a struggle around human rights and dignity.
Okay, so what a wonderful place to wrap up, except don't you want to keep going? But yeah, see, everybody's like, yeah, you know, how timely. Realize what we were thinking when we had this date. I'm not supposed to say this. You were either going to be like mostly sort of mopey, trying to be aroused, or saying, yeah, okay, that resonates, we'll keep going. So at any rate, we have two, as you know, amazing individuals, both present and in the history of the world, and certainly in the history of South Africa, Mr. Ahmed Kathrada and Minister of Health, Barbara Hogan. And I want to introduce our president. You're famous too. Yeah, I know I wanted to make you president. He's like, I'm not the president. Okay, doesn't want to be the president. Our provost, Mark Greenberg, to do a quick presentation. Mark.
Thank you, Marla. I could not develop a Greek accent that quickly. First of all, I want to acknowledge the role of the School of Public Health and its leader, its extraordinary and exceptional leader, Marla Gold. And I want to thank our distinguished guests for traveling all the way to Philadelphia to give this important talk. You can tell from the turnout and the enthusiasm that your words have had a tremendous impact here. I also believe there could be no finer memorial to Jonathan Mann than your brilliant interweaving of his words with the words of your countrymen, your courts, and the movement that you have helped to lead. So for that, we are very, very appreciative. You both represent, in a way, the spirit and legacy of Jonathan Mann. And in recognition of that and of your service to the university, I have these university bronze dragons, which have been inscribed with your names. And this is to Mr. Kathrada. And to Minister Hogan. For us, the dragon represents excellence, fortitude, leadership, and courage. And I can think of no two finer people that it is our honor to present them to. So again, thank you for being with us.
That's me going, we promise we'll ship them back. Don't worry. They're really bronze. They weigh a ton. Please join us in both thanking our guests one more time and join us outside for a reception. Thank you.